Increasing attention has been paid to private equity investments in the U.S. healthcare system and their potential implications for patients and healthcare workers. But private equity firms have also entered healthcare systems in various other high-income countries, drawn to profit opportunities in private sectors in each system. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with Yashaswini Singh, an assistant professor of health services, policy, and practice at Brown University. Dr. Singh has co-authored a perspective article examining the rise of private equity in healthcare internationally. Dr. Singh, what's known about the amount of private equity investment in the healthcare system in recent years, both in the United States and globally?
So, in the United States, we know that over the past decade or so, there's been a steady increase in private capital flowing into healthcare. And more recently, this has been driven by private equity firms. It's hard to come up with a specific number because there are so few reporting or disclosure requirements that govern these transactions. But industry estimates suggest that PE firms have invested upwards of $1 trillion in the United States healthcare system, ranging from every healthcare setting from cradle to grave. So this includes investments in settings like fertility services, primary care, behavioral health, hospital care, even nursing homes and assisted living facilities.
What are the potential benefits of that investment and the potential harms?
So one might say that the United States healthcare system is often characterized by a lot of waste and redundancies, high cost of care and inefficiencies. And so proponents of these trends might say that private equity firms, with their emphasis on driving efficiencies, might provide a solution to some of the characteristics of the healthcare system that are so frustrating for consumers of healthcare or patients in healthcare. Oftentimes, these efficiencies might take the form of improved wait times or improved access or investments in technological infrastructure that then can help practices, for example, compete for value-based care contracts. These are all theoretical possibilities and potential benefits that can come out of investments of this nature, but on the empirical side, we haven't quite seen these benefits materialize as benefits either for patients or for healthcare workers. There are a few takeaways from my research and researchers that others have done in the space that are worth noting that highlight some of the potential harms that can come about from private equity investors with their short-term emphasis on profitability within healthcare. So first, we've seen that when PE firms buy a physician practice, healthcare costs go up. Doctors are made to see more patients, perform more tests, and oftentimes these have uncertain or outright harmful implications for the quality of care. In other areas, in hospitals and long-term care facilities, for example, we've seen private equity firms strip real estate assets and cut critical but less profitable services. The consequences for patients and healthcare workers are still unfolding, but overall, the prognosis does not seem great.
What features of the U.S. healthcare system have made this possible, have facilitated the expansion of private equity in the sector?
So that's a great question. It's also a tough one to answer because I think the growth of private equity in the American healthcare system is also kind of mirroring the growth of private equity outside of the US. In general, these trends are driven by a complex interplay of factors. So, on the one hand, we have an aging population and a growing demand for healthcare. As people live longer, they're likely to demand more healthcare services. And so all of these factors together make healthcare overall a lucrative investment opportunity for PE firms. Now, at the same time, there are specific characteristics of the American healthcare system and health system design that might make it easier for PE firms to enter and identify opportunities for profitability within the system. So, for example, the US is often highlighted for its exceptional characteristics or exceptionalism when it comes to health system design. We have multiple private market actors, both payers and providers. We have significant funding from private sources, such as private insurance premiums or out-of-pocket payments paid by consumers. We also have services that are largely delivered by for-profit providers. And at the same time, we have very little price regulation. So all of these distinctive features of the American healthcare system combine to form really the perfect storm that makes healthcare so attractive to PE investors in the US healthcare system.
So you say in your perspective article that countries that rely more on price regulation and public financing might be expected to be less vulnerable to corporate influences in healthcare. But private equity players have emerged in those countries as well. How have firms made inroads in countries with these various approaches to healthcare regulation, to financing, to delivery?
So given the distinctive features of the American healthcare system we just talked about, when I started working on these topics, myself and other colleagues in this space, a lot of us thought that PE investments in healthcare are a uniquely American phenomenon. But as you mentioned, and as we write about in our perspective piece, we've been surprised a little bit to see that even countries with greater price regulation, greater public financing, or even greater public ownership have not been immune to these trends. The one noticeable thing we've seen is that private equity firms have developed sophisticated investment strategies where they've identified specific profit driving sectors, even within systems that are publicly financed, by identifying the private portions of those systems. So, for example, in the UK, we've seen upwards of 150 deals in recent years. Now, the UK is a great example because you have the National Health Service, which is largely delivering publicly funded care. But at the same time, there are sectors within the NHS that are characterized by private provision of healthcare services. So, primary care is the example we write about in our perspective piece, where general practitioners are not directly employed by the NHS, but instead provide contracted service to the NHS. So even within this publicly funded system, you have primary care as a setting that is characterized by private care delivery. And that is a setting that we highlight has attracted private equity investments. Similarly, the long-term care sector, care homes in the UK also are largely outside of the NHS system. And that's where we've seen PE firms currently operating 3 of the 5 largest care home providers.
So in the United States, policymakers are at the stage of debating proposals of how to monitor the growth of private equity in healthcare, but some other countries have taken action to safeguard patient interests. What are some examples of that?
One of the challenges with understanding the extent of private equity activity in healthcare across countries is the lack of ownership transparency and disclosures that or reporting requirements that surround these deals. And so a lot of the policy momentum in the United States has involved shedding light on this specific call to action, right? You cannot solve a problem you cannot see. And so an essential first step in understanding whether this is a trend to regulate or monitor or even incentivize in settings where it might generate beneficial outcomes, understanding any of that requires better data. And so a lot of policy action within the US is focused on improving ownership transparency. Now, outside of the US, there are examples, for example, of competition commissions in different countries, Australia in particular. There was a recent case that was similar to the lawsuit within the US that the FTC brought, where the Competition and Consumer Commission in Australia published concerns about private equity firms using consolidation strategies in ways that can affect care for oncology services. And so, greater antitrust scrutiny and oversight and ownership transparency are 2 such examples. We've also seen in other settings, countries have greater propensity to take action to regulate prices. A lot of the concern around private equity in healthcare involves concerns around how these trends might affect the affordability of healthcare services by increasing the cost of care. Now, the United States in general has very little price regulation, which really leads to a situation where PE acquisitions can increase the cost of care without any checks and balances. But in other countries, we've seen policies that regulate the level or amount of prices that can be charged for healthcare services by equalizing them regardless of the setting where care is provided or the ownership incentives or the ownership characteristics of settings where care is provided.
And how effective have these regulatory responses been?
So at present, we don't have enough data to have a good answer to that question. As I mentioned, we have very little awareness and systematic data collected on these trends, both within the US, but also certainly in other high income comparable countries. And so this makes it really challenging to understand certainly what are the trends in private equity acquisitions in healthcare, But also, given that we have seen policy action being taken across countries with different healthcare systems, it makes it really difficult to understand what the intended or unintended effects of policy intervention can look like. So, this is a key reason why having better data on ownership trends will make it easier to understand, one, from the policy lens, what are the factors that can incentivize or discourage private equity entry in healthcare markets? But also, two, what are the effects of policies that target these trends? Are they slowing down investments? Are they safeguarding patient interests? Or are they encouraging and incentivizing private investments in ways that can drive these purported benefits while also at the same time safeguarding healthcare workers and patient interests?
Finally, are you expecting the current Congress and the Trump administration to take action in the realm of private equity in healthcare? What regulatory changes do you think we might see?
I must emphasize that private equity investments in healthcare have really caught bipartisan support and interest in the United States. Last year, there was, under the Biden administration, the Department of Health and Human Services, Federal Trade Commission, and Department of Justice launched a public request for comment where patients and healthcare workers and really anybody who had any interaction with the healthcare system could share their experiences and help policymakers and regulators identify specific areas that might warrant closer scrutiny. At the same time, we've seen multiple congressional investigations into private equity involvement in hospitals and emergency rooms and their role in the opioid crisis. And so I am hopeful that with continued ongoing spotlight on these topics that the Trump administration will also continue to support researchers in understanding the effects of these trends, but also be nimble to act specifically in areas where these trends can have detrimental effects for patients and workers.
Thank you, Dr. Singh.